My name is Lynn Fantom. I'm an oncology nurse navigator working mainly with breast cancer patients. When a patient hears for the first time that she has breast cancer, the nurse navigators are present, and then we're able to help that patient through her entire journey with breast cancer. We're able to make appointments for her, help her with any other support that she might need. We really are there from the beginning. When you hear you have breast cancer, you're devastated. And if I can say, that's the worst thing I'm going to tell you today, now let's focus on the positives, it makes it so much better. You not only treat the patient, but you treat the family. Families go through a lot of emotions, and as well as the patient, and sometimes families feel helpless, like they don't know how to help their loved one, and so we're able to help that. We have patients with young children. I have a patient who had a 19-month-old at the time she was diagnosed. How difficult is that, to be diagnosed with breast cancer and still manage to be a mom and a wife and a sister and a mother and all those things. So we're able to really help them in dealing with, how do you tell people that you have breast cancer? And the first question, one of them is, am I going to die? And so you're able to hopefully help put that fear to rest and know that there's lots of wonderful treatments and physicians and teams to take care of you during this time.
I'm Lori Rainier. I'm a breast cancer survivor. I don't know how I would have gotten through my journey without her. She was a great support. She was there to answer any questions or concerns that I had. And when I found out I was going to have chemo, and how do I tell my kids that? And she was there to, with me right there and help me get through all the appointments, get them scheduled quickly. So she was a great support, and still is a great friend to this day, actually.
I met Lori over 5 years ago when she was first diagnosed. I knew from the beginning that she was a wild woman and was going to take this breast cancer diagnosis head on. And she had, I called them the ya-ya chicks with her, because they were always with her. They were there for her whenever she needed them, whenever she was at an appointment. So I helped the whole gang, and they stood by her. They shaved their heads with her, they drank wine with her, they cried with her.
It was a little scary, but I have some great chick friends who were there with me for the diagnosis, and we dealt with it with a lot of humor, and they let me have fun with my journey the whole way through. So that helped me get through the whole process.
She impacted my life because, I actually looked forward to the day she had treatment. She would make me laugh. She would come to every treatment dressed up differently. One year she had her head, it was Christmas, and she had her head decorated like an ornament. One time it was her mom's birthday, and her cake was decorated her head was decorated like a birthday cake. She made me know that humor is a big part of coping mechanisms to get through a cancer diagnosis. You go through things for a reason, and you know where you are in your life for a reason, so she made me realize that even more.
Having cancer is always going to be a part of my life. I'm still cancer-free, so I'm grateful for that. But I always have my incisions, and my body is permanently changed, so that's never going to go away. I'm never going to forget about it. And now I work in marketing in the healthcare field, and I get to work with the same people. I get to work with my nurse navigator, and I get to work with the doctors that treated me. So it's come full circle.
I learn from each and every one of my patients. They give me inspiration and courage every day to go and do what I do, and make me realize that there's nothing in life you can't handle. We're continuing to make strides every day, and hopefully someday there'll be a cure.